Welkom op Mobile Healthcare met als eerste gesprekspartner een man met een Indiase achtergrond. If I would be the leader of the EU and you would have to introduce yourself to me, how would you do that?
Oh, very tough question. EU is made up of lots of countries, but I think what is one thing common out of there is I think patients are looking for next level of interaction with healthcare. So if I was to introduce myself, I would say I'm working for a company called ServiceNow, and we are looking at how we can help that journey for EU countries in bringing digitalization to the front line for healthcare.
Yeah. And would you mention your name?
Yeah. So my name is Dr. Seemit Dhage. I'm a medical doctor by background, and I used to be an ex-surgeon working in the NHS.
In which field that you do surgery?
In orthopedics, trauma and orthopedics. Yeah.
Oh yeah. So you're still sitting in this meeting with this EU leader, and I would ask you, how can you and your company make a difference compared to other companies?
It's all about experience for us. You have seen it in other industries when we come to say banking industry, transport, etc. The key thing is, how do you deliver the next level of experience? So when it comes to healthcare, I think what we need to focus on improving patient experience and employee experience. What we do as ServiceNow is, for the patients, we deliver a high quality experience along with the healthcare providers, and for the employees, especially after COVID, we want to deliver the best experience for them by giving them time out. So giving them time back so they can focus on healthcare, they can focus on their personal life. So ServiceNow focuses on delivering experience for patients and for employees.
And is that so much different from what other companies try to do then? Because one would say, well, everybody's doing that.
I would say, how mature other companies are in the digital space, that would be the difference, right? We are a platform-based company. We specialize in digital experiences. And through that digital experience, it is, how do you simplify, how do you make things seamless for people to do things? For example, in a hospital, if two employees want to communicate about patients, it's a very manual, repetitive process. If we can make it digital, it makes life easier. If we bring automation into picture, it becomes even easier. So this is the way that we can improve experience for patients.
And how do you combine that with, let's say, the human factor? Because we're not only digital beings, we become more and more digital beings, I know, but we're also human beings.
Correct.
So how do you make that combination?
I think, again, it is understanding what people require. And, as we have seen, how technology has improved, it has focused more on, how do we, reduce time. If I give you an example, 10 years, 15 years ago, we all used to go walk into a bank and get our, finances sorted out. We now no longer do that. We do everything from our handset, from our mobile. When we come onto healthcare, we expect the same kind of element coming into healthcare. So this is where I think we can touch that human element to say, can we bring the same level of consumerism, but not in a financial way, consumerism in terms of experience that we have experienced in, say, the banking industry or transport industry into healthcare.
How come it took so much more time in the medical world compared to the bank world?
So medicine historically, or healthcare historically, has been slow to adopt technologies. It's the inherent nature of healthcare where they want or we want evidence-based, something which has been tried and tested, etc. However, because of COVID, what you have seen is it's changed how healthcare is delivered. Now you see more and more, say, virtual appointments tele appointments, phone appointments, which previously didn't happen. You had to go and visit a doctor at his or her clinic.
Yeah.
Now we can have those arrangements. So what has happened post-COVID is that the adoption of, say, digital technologies has been accelerated. And that's where we see and we hope that this pace of acceleration will continue.
Yeah.
And we'll see more adoption of technology going forward.
And where can we see you and your company in practice? Where do you work? Which places, which surroundings, which hospitals, whatever?
Yeah. I'll give you one example from the UK. So at the heart of pandemic, when the COVID vaccines came out, so we supported NHS Scotland. So they have a population of close to 4 million. So we were able to put in place a vaccine administration program for them, where now you see over the last 2 years, patients receive notifications, digital notifications about them being eligible for vaccines. They can go on patient portals and choose and book where they want the vaccine. But then also on the clinic side, the clinics can look at the availability of vaccines, availability of people who can administer vaccines. So we've been doing that successfully for NHS Scotland. The other example I would give is we're currently working with the Norwegian health system, where we will be building what we call as a surgical cockpit, where they have a lot of patient cancellations. So we are trying to address that problem to say if we can give them almost like an air traffic controller's view of where are the delays,
coming in, going out.
where are the delays, what is the potential kind of problem, and we can anticipate that and we can rectify it for them. So that is again another health system that we are working on.
Yeah. You're also working in India.
I don't personally work in India, but we do, yes, we have some presence.
What kind of projects do you have there?
So we work again, support a lot of hospitals on their IT departments, HR departments, and delivering some of those workflows.
Can you give me an example of a different way of treating the digital developments in, let's say, India compared to the States or the Netherlands? Because there's also a cultural aspect in the digital world, of course.
Correct. I would say the most fundamental difference is, the presence or the absence of a public health system, right? At least in the Western European worlds, we have, public systems like the NHS, or here, in Netherlands, we have, the system being partly funded by the public sector, etc.
Yeah.
So there is some level of governance and I would say responsibility of delivering public health care. As we go into, say, the Indian subcontinent, and India is not an exception, I think that I would say there is importance, but the delivery is not that effective as you would see in the Western world.
Yeah.
So that is one of the, I would say, big difference. So you see a lot of private sector where, especially on the Indian subcontinent, where patients have to pay out of pocket.
Yeah.
Or through insurance schemes, etc. So there's a big difference in that.
Does this mean that people in what we called the developing countries, in earlier days we called them the developing countries, does it mean that you get, let's say, two sorts of people who can afford to be part of the digital world, and other people who can't afford to become part of that?
True. And that, I wouldn't say it's, a world for haves and have-nots, but yes, there is a clear kind of, I would say, demarcation or differentiation in terms of, how much healthcare can you afford? How much healthcare can the government support in delivering you?
Yeah.
There is choice, but what you also see in, especially in the Indian subcontinents, there are, I would say, other healthcare delivery models where you have Ayurveda and some of the other kind of non kind of allopathic medicine options as well, which patients sometimes use for non-emergency conditions.
Yeah. Can you change as ServiceNow anything in this field? I mean, the haves and the have-nots. Can you help the have-nots?
I would say, things like having a digital front door with, capabilities like virtual agents, where, we have virtual agents when we open our bank app and, the virtual agent will say, what are you looking for today,
Yeah.
right? That's, so you can bring the cost of healthcare down through automation, through artificial intelligence, and make delivery possible for the lower I would say income category of population.
Yeah. Your mother is living in India.
Correct.
In up till which level is she part of the digital healthcare system?
So my mother, she's been a gynecologist for last 50 years. She decided to take retirement after COVID. I would say, during COVID, she was, as a practitioner, participating in number of patient to doctor, consultations. So she's already, without her realizing, been a part of that kind of healthcare delivery model.
Yeah.
So again, that is pretty much, her kind of.
And her patients?
Her patients, again, we have things like WhatsApp. I know it's kind of, we get into the security and confidence aspect of it, but, especially in countries where there isn't a formal way of communicating digitally, you have consumer grade technologies such as, WhatsApp things, which people can still use and have those communications.
Yeah. Let's return to Brussels, where we were having this conversation, me being the EU leader and you visiting me as an employee of ServiceNow. If I would ask you in that capacity, what your advice is on what to change in the EU when it comes to digital things, what would your advice be?
So, predominantly the European nation, most of the countries have some public health system where, the hospitals or the care delivered is reimbursed by the government or the public sector. My one recommendation or suggestion would be that reimbursement is still very activity based, where, I'm going to treat 100 patients, I get, paid for treating 100 patients. It needs to move a little bit, I would say, towards value-based care, towards outcomes-based, and it also needs to incorporate digital technologies. Say if a hospital wants to reduce its cost by having a virtual agent as a digital front door where patients don't need to turn up in the hospital, they can log in through artificial intelligence, virtual agent, decide whether this is important or not. So the point I'm coming at is from a policy point of view, the reimbursement for digital technologies needs to open up and it needs to become, I would say, mainstream, like, the other kind of way of reimbursing.
Okay, and then I would say, okay, I'll think about that suggestion. How much is that going to cost me?
I would say, just from experience, and this is my personal view, technologies when they are new may cost, a bit higher, but as we have larger rollout adoption, there's economies of scale kicking in. So I don't think so. There's a right answer for me to say whether it is, cheaper than what we have. But there's obviously an economic case over there, where as more technologies are being adopted, it becomes, more cost effective.
Okay. Well, being a politician, I would say I'll talk about it with my colleagues. Thank you very much.
Thank you. Have a nice day.